As you know, the province of Quebec, like the rest of the world, has experienced an unprecedented crisis in the recent month. At the request of the Quebec Prime Minister, we have done an appraisal of this first wave, so we can now establish the solution to be implemented in the view of a potential second wave. Our government is presenting today a measurable action plan. It revolves around 9 areas of intervention, including living environment for seniors, the workforce, massive screening, supply, and governance. In particular, the government of Quebec is mobilizing in the following: identify a manager responsible for each CHSLD. We need to recruit attendants in each CHSLD. Prohibit the movement of employees. Reduce the time taken for the entire screening process. Support an optimal service offer in surgery. Establish clear and agile governance. Maintain a constant dialogue with the general managers to ensure the implementation of directive. And this is how we will respond to the mandate that the Prime Minister has given us. Together, we went through the first wave, and it is together that we will beat this virus. There will be no mobility. I'm going to be very clear. It will be no mobility, and the only one that will be allowed will be with, for nurses and auxiliary nurses, under the one condition: they respect our measures of prevention and control of infection. So it's not for préposés aux bénéficiaires. We have enough personnel now for that. The issue is with auxiliaires, infirmières auxiliaires, and nurses. We need to make sure, and that's the reason we give those 6 weeks, the next 6 weeks, to all managers to say, okay, now you cannot allow the transfers of people between floors or between establishments. So find a solution and show us that those transfers will be under the rules of prevention and control of infection. So this is exactly what we're saying. Let's look at what we have done. We made sure now on those gloves, trousers, especially the mask and 2 types of masks. I'll talk about N95 and gloves. See, we limit ourselves to those 5. There are 2 that are still under, can I say, a certain level that I would like to be more. Gloves, because they're only manufactured in one place in the world. So we are dependent of them. And the other one is N95. All the others, we have the resources, we have plenty of them. The issue with N95, as you know, is that we've asked to be, and Minister Fitzgibbon have made some arrangement with one company that now is setting up shop in Montreal. They will be ready to manufacture those N95 by end of October, beginning of November. But the time that we need for certification could last a month and a half. So the issue is that we will have plenty of N95 at one point. Is it December or January? We are in that zone. So what we decided to do, even though we'll be autonomous by, say, beginning of the year, that we're still buying N95. So we don't have the same level of N95 right now, but that's not going to be an issue in a few months because of the manufacturing will be done in Montreal. On the gloves, nobody wants to make those gloves because there are some big issue, environmental issue, the way they are being manufactured, latex and all those reasons. So we need to improve or to increase the number that we have, and our people at procurement are doing that right now. But for those 2, this is the focus that we have. For the rest, we're okay.